When you find an enlarged lymph node, do not stop at naming it. This reel gives you a bedside sequence you can actually apply in clinical practice. Start by describing the node properly. Ask yourself, what is the site, the size? Is it tender or non-tender? What is the consistency? Is it mobile or fixed? Are the nodes discrete or matted? And are there any skin changes overlying them? A node should never be described as simply enlarged. Next, apply all. A stands for age, because age helps narrow the likely causes. L stands for location, because location suggests the drainage area and therefore the likely source. The second L stands for length of time, which helps separate an acute reactive process from persistent disease. Then apply ages. A is for associated symptoms, especially fever, night sweats, weight loss, sore throat, or other infective symptoms. G is for generalized lymphadenopathy. E is for extranodal involvement, and S is for splenomegaly. This step helps you move from a local finding to a wider clinical picture. After that, examine the drainage area. If the node is cervical, examine the mouth, teeth, throat, ENT region, and thyroid. If it is axillary, examine the breast, chest wall, and upper limb. If it is inguinal, examine the lower limb, genitalia, and perianal region. If it is supraclavicular, think carefully about the chest and abdomen. Never examine a lymph node in isolation. Then look for other node groups systematically. Examine submental, submandibular, cervical, supraclavicular, axillary, epitrochlear, and inguinal areas. At this stage, decide whether the patient has localized or generalized lymphadenopathy. Now complete the general examination. Look for mouth and throat lesions, skin lesions or rash, chest findings, hepatomegaly, and splenomegaly. At the bedside, this should make you think of infection, tuberculosis, lymphoma or leukemia, metastatic malignancy, and systemic disease. Finally, identify red flags. Be concerned about a supraclavicular node, a hard or fixed node, matted nodes, generalized lymphadenopathy, B symptoms, hepatosplenomegaly, or a persistent unexplained node. So the practical sequence is simple. Describe the node, apply all, apply ages, examine the drainage area, check other node groups, look for systemic signs, and identify red flags.